Hey, everybody. Welcome to Keeping It Spiritually Simple. I'm your host, Sandra McEllis. And before we get into our very awesome guest today, I'd like to ask each and every one of you to like, subscribe, share, leave a comment. If you're listening to us on a podcast channel for the audio, you can go over to my YouTube channel, Sandra McEllis, and you can put faces to the voice. And we love it when you subscribe, like, and share and comment on that channel as well. Because as we know, the algorithm dictates how much this video circulates. So today it is my honor to welcome Dr. Monique. And as you all know, I'm going to do my best to keep it 20 minutes or less. And this is going to be an intro video on a little bit about Dr. Monique and how she was before she became a doctor and becoming a doctor. And then we're going to do round two. So welcome, Dr. Monique.
Thank you so much for having me. Appreciate it.
It is my pleasure. So, you've got a lot of credentials behind your name that were very new to me, like neuropsychometrician. That to me was like, what? That is so interesting. So when you were a kid, were you like a science nerd? Did you like to, solve puzzles? Were you an observer of like behavior of people around you? Were there things going on that just your brain just gravitated towards that science, that unique um, learning of something different than just being a kid?
Actually, the complete opposite. I hated science with a passion. I hated math and I hated science. But growing up, I did want to be a teacher. When I was 5 years old, I won a writing contest. The question was, what did you want to be when you grow up? And I said, I want to be a teacher because I want to teach kids how to read. So moving on, I think that was something that I wanted to do up until maybe high school. You're a product of your environment. So my teachers were wonderful growing up. I've always had great experiences with each and every teacher that I had along the way. But it wasn't until high school I thought, I want to be an accountant. That lasted only maybe a couple of months. And I'm like, no, this is not for me. And then I started to be interested in criminal justice. Now, when you find criminal justice, there's forensics there. I was very fascinated by this TV show called Forensic Files. I don't know if you're familiar with it. Oh my gosh, it came out, I want to say maybe early, late 80s. I was a kid when I was watching it. And it was based on, well, one, the narrator, he has this soothing voice. His name is Peter Thomas. And he would cover murder mysteries or anything that was based on scientific phenomenon. And I don't know why I was fascinated with it, but I would watch it all the time. And I was still watching it throughout high school, and I became really fascinated in criminal justice because of law enforcement, that show, and then looking at scientific evidence to solve crimes. But it took a turn my senior year in high school. About 3 weeks before I started, I seen an Air Force commercial. And I'm like, oh, this is fascinating. I just was like, let me see if I can contact my nearest recruiter just to get some information. So right after I saw that commercial, I found the contact information. I emailed the recruiter. He contacted me the very next day. He's like, can you come in the office so we can chat? So I'm like, okay, cool. A chat, right? So I go in, I had my grandmother bring me down because at the time I was 17. And about 4 hours after meeting with that recruiter, I'm like, oh, I'm joining the military. And my grandmother was frightened. She's like, no, not just after one conversation. You're going to join the military. I'm like, this sounds interesting. I want to do it. And we went back and forth. And literally, I was like, well, I'll be 18 in 2 months. So if you don't sign now, I'll just come back in 2 months. So she signed for me to join the military. And my life took a quick turn. I went from wanting to be a teacher, accountant, I'm interested in criminal justice, and now I am joining the military in about a year. So that's how everything really happened to further my interest in criminal justice still, but further my interest in forensics more or less than, you know, understanding anatomy and physics, all those things that were tough, growing up. Um, I did end up graduating. I joined the military in 2002. And then by that time, I'm like in information communications, working on web design, basically computer IT stuff. And I'm like, that's not for me. This is not what I really want to do. So I was looking to do another job. It's called cross training in the Air Force. So didn't necessarily get to cross train, but I moved into national security, which I found to be very fascinating, doing a lot of security work behind the scenes, stuff like that. So that was like the majority of my career until it ended. I did 13 years and I was working in national security. And I thought those two, criminal justice and national security, both interesting fields, but they overlap too. So once I transitioned out the military, which I should back up because the reason why I transitioned brought me to where I am today in the field that I'm doing. Um, I did start teaching while I was in the military. I was teaching criminal justice. That was my first class ever taught. And I'm like, oh, I really do like teaching. So I'm going to get out and do this full time. I thought about it. But when I deployed to Afghanistan, I really saw the toll that, the war impacted people's, psychological states, the way they performed their duties, the way they interacted with colleagues and even their family members who were still, overseas back home. And so me being really interested in why people change due to different environments, that really interests me. And I started doing a bit of research. Um, so between teaching and research, I got really in a knack for criminal justice and psychology and national security. So I'm mixing all these together, and I'm actually in the cusp of teaching all these different fields too. So when I transitioned out the military, I started teaching full time and doing research. And I'm like, I'm going to get a degree in psychology because at this time I had a background in homeland security, I had a master's in criminal justice, and then a PhD in public policy. So I'm like, I'm going to go back to school. I'm going to get a master's in psychology. So when I did my thesis on the war. And I noticed that a lot of people who had deployed to Afghanistan and Iraq, they came back significantly different. And like I said, firsthand, I was there. I know. So I saw the effects and how people came back changed. And it made me wonder by myself because I'm like, okay, a lot of people have changed, but have I? Because I was exposed to some things out there being an anti-terrorism officer and doing, different missions at night. I was exposed to a lot, but I felt like I was the same and people around me were like changing. So after really looking at myself and saying, let me look and see, how I compare to others, I realized it's not about who I was technically. It was about the external factors that were, influencing people to make different decisions, change, and be different around me as I thought that I was normal around them, if it makes sense to you. So continue to do all that research. I'm like, yeah, I'm going to hit this timeline of people who were in Iraq and Afghanistan and see what's really going on. So when I did my thesis for that degree, um, I realized that 50% of the people who came back from those deployments were diagnosed with a mental health condition, whether it was depression, anxiety, PTSD, but the number one factors were PTSD and major depression. That was the difference that I was seeing in people around me. I'm like, oh, they're depressed. So that's why they're acting differently. Am I depressed? Well, no. But I did come back home thinking that things were different. because I felt like what we were doing was bigger than what we were doing in the United States. We were legitimately trying to keep the United States safe. And then when you come home, you're happy to see your family, but then you feel like you have nothing to offer because you're still not in the war zone. You're not in the combat zone anymore. So that's what I noticed about people around me being different. um, I kind of felt that way for a little bit, but then I got right back into my work because I'm like, I'm on a mission to figure out more about what's going on with mental health. So by the time I finished my master's degree, I went and got a second doctorate in clinical psychology. And that's really where I've seen the effects of mental health and war, through my extended research for my dissertation. So I kind of expounded off of that thesis. And on my dissertation, I took a time frame from 2005 to 2016, people who were deployed in Iraq and Afghanistan during that time frame. And I'm like, I'm going to look and see what are the common denominators. Again, 50% who came back from that time frame were diagnosed with not only major depression now, but PTSD and traumatic brain injury. Predominantly, there were white males enlisted between the ages of 18 to 35. So it was even a span of age, but they were fairly still young. And then those purported 50%, another 50% of those who were diagnosed with PTSD, major depression, or traumatic brain injury, 50% of those went on to commit violent acts, which either ended up in being discharged or they were screened and felt like, oh, due to their mental health, they're going to be medically boarded out of the military. And that way they were discharged. Or, some of them were discharged just based on bad behavior. However, some went undiagnosed, some went misdiagnosed, and then some who were diagnosed were not treated properly. So my thesis showed that external factors like combat zones and being exposed to combat, being exposed to that on a daily basis, especially if you're doing 6 to 8 month deployments, and then you have branches of service like the Army, who can be out there for 12 to 15 months without a break. And then they come back to where they see a sense of normalcy and they can't handle it because all they're thinking about is what they experienced in the war. So that causes mental health conditions, which goes untreated. You can have a mental disorder that's undiagnosed or diagnosed but not treated properly. So when they're not receiving the proper treatment, they go on to commit acts, maybe due to frustration or not even understanding themselves once they come back because they don't really know what's going on with them. They don't really know what's happening. So in my research, I showed that only 1%, even though it's low, it's still significant because 1% of the population who had committed violent acts that were diagnosed with a TBI or major depression or PTSD were not deemed criminally responsible for their actions because of the significance, the severity of the disorder, the fact that it was untreated, the fact that they were not aware. And to me, that made a difference through that research because that 1% led me to further conceptualize what was going on. We have the field of clinical neuropsychology, and then we have the field of forensic neuropsychology and forensic psychology. But neuropsychopathology is really understanding how your brain is diseased due to either a medical condition or due to a mental health condition. And so even though mental health and the medical fields, they align, they have overlapping issues because if you have an untreated severe mental illness, it can affect your health, which leads to a medical condition and vice versa. If you have a medical condition and it's long term and you feel like there's no reprieve, that can lead to a mental health condition. So that's where neuropsychopathology came from. I didn't coin it. Somebody else had established this theory years before my time. But I always wondered why people didn't focus on neuropsychopathology because mental health conditions impact how your brain functions. And if your brain is not functioning properly, it's going to mess up your entire body. The brain is the heart of a human being. So if it's dysfunctioned or diseased, it's going to impact every other organ and every part of your body. So that's where I conceptualize the framework forensic neuropsychopathology, because I really want to understand more about neuropsychopathology and then what it means in a legal setting. Because as we see in time now, there's a lot of, crimes being committed, not just in the US, but they're high profile. And then once something happens, we find out that the person who's responsible had a history of mental health conditions. They were constantly in and out of, psychiatric hospitals or rehabilitation. And then they commit this crime, and then we're wondering, should they be held responsible? And it all comes down to the legal setting: criminal responsibility, criminal accountability, insanity, and competency at the time of the act. So that's how all that came to fruition. At 5 years old, I didn't think I would be here, because at 5 years old, I didn't even like science and math. But then it's like over time, I got interested in the legal justice system, criminal justice, national security, and then it just all seemed to come together just based on this one theory that I had in school.
I am sitting here listening to you and I'm like in awe, and I just don't want you to stop talking because not just your story, but the fact that you wanted to dive deeper into the unseen trauma that has been internalized in our military is really where I'm hearing the catalyst of what propelled you into what you're doing now, and more education into that, is because we don't know, we don't see on the external when someone has a mental illness. We may see it in a behavior, but we don't see it. And then sometimes there's a temper tantrum or snap factor, and of course it builds over time. But the fact that you dove all into this, I'm just in awe of you right now. I'm almost speechless. I was thinking about people with chronic pain and how it changes their brain and changes their organs and changes their body. I mean, I can speak to that on a personal level, and how I have to mentally override that. And then there's times where I can be in it and it's very acute in that moment. And I have to remove myself from situations because I'm not going to be a very nice person. And I've chosen not to go down the medication route to numb it. I've learned to find other alternatives to help me deal with it. But I can only imagine being in the mind of all of this, because we don't realize how much war or going to another country and seeing things that we've never seen before truly affect us. Even if we haven't been on the front lines of something, we're seeing it all around us. So just those events and those experiences change us for life. And I don't think we're giving enough attention to the military that goes out there and literally guards our country in every way, shape, or form, and then comes back. And I don't like to use the word broken, but parts of them, segments of them, are very broken, and they need assistance to rebuild before they get into a violent act. I don't think we're getting enough attention with that, and that could be a whole other show. But does it, what I'm saying, make sense?
It makes a whole lot of sense. And I know you didn't want to use the word broken, but that's how a lot of them feel when they come back. They feel broken, like not themselves. Who am I? And then it becomes this whole identity crisis, especially if they're forced to leave the military because of their mental health conditions. Their whole identity has been the military. How am I supposed to survive once I leave? This is all that I know. Most of us went in right out of high school. I signed up at 17 and got out at 31. So you can imagine I had a hard time adjusting. When I went to therapy for the first time in 2017, unfortunately, one of my friends committed suicide. That was in the Air Force. And I went to therapy to deal with that, and then realized that my psychologist, she diagnosed me with adjustment disorder. She said, "You're having a hard time adjusting from military life to civilian life." I questioned everything. I'm like, why are civilians so disrespectful? Why do, younger people call older people by their first names? Because, I was told to respect my elders, and then being disciplined in the military, you're very respectful. I would never call somebody who's 60, 70 years old by their first name. And then I'm in this whole new work environment and everybody's doing it. And I was just like flipping out. It's like, what world am I in? So I'm thinking I'm going to therapy to deal with my friend's death. And she's like, we need to help you easily transition, have a smoother transition into civilianhood. And I said, well, I guess for me, it will never be civilianhood because I'm a veteran now. So it's just me being a veteran trying to, acclimate into, I guess, this new world that I'm going to be in. So if you can imagine me going through that, imagine Marines, infantrymen, the army who's deploying 12 to 15 months at a time, and then they're coming back, decompressing for a few months. Then they might get a little bit of time with family, and then they're back into training, and that training is building them up to go back again. I have friends that deployed like 11, 12 times in their careers.
Yes.
And so they do come back broken, and they do say that they're broken. Some say that a lot worse than that. And I've dealt with that not only with people that I know coming back and me being active duty, but in the position that I'm in now when I used to see veterans for evaluations. Yeah, it's a lot worse what they think of themselves, and then how they feel that they're viewed by other people, the
Yes.
stigma.
Well, yeah, and as an energy body worker, we know the levels of when you're vibrating on shame, guilt, blame, lack of confidence. Those are very low, dense, vibratory um, frequencies, and those feed on all the negativity. So it's very heavy in the body, mentally, physically, emotionally, etherically, and spiritually. But I want to touch base on something. You said most people enlist or go into the military right out of high school. Now, back in the day, it used to be 18 you were competent enough to vote for who was going to run your country, but you were not competent enough to drink alcohol because you needed to be 21. And now the studies are saying that the brain is still developing up to age 25. Now, God knows what
Mm-hmm.
they'll say in another, 25, 30, 40 years. I think the brain is always developing and always changing, not just because of experiences and situations, but just in general. I don't think it's ever a hard, um, the brain's not a muscle, but I don't think it's ever fixed, totally fixed, unless it's something that's a behavioral choice, maybe. But I want to talk about that. Do you think that they solicit for younger people because they just don't know any better? They're not developed enough. And I mean, I do know that in certain states, um, counties, and neighborhoods, people don't have a choice. Military is their way out, going into the military.
That's
We could
true.
be going totally off base here, but I'm being called to say something about the 25-year-old. So what would you say to the brain development between 18 to 25, and how much of that plays a part? And then you're adding all these adjustment disorders and lack of ability to be adaptable and flexible and learning and getting out of your own behavioral sense of programming that you've learned up until that moment, and going through
Mm-hmm.
those experiences situation by situation.
Well, to go back to your initial question, I honestly don't think that the military really thought about brain development, when you're recruiting young people to come into the military. I'll tell you, I joined in 2002. And in retrospect, I think it's more of the ability to be able to shape and mold people at a younger age than more of understanding brain and cognitive performance at 18 and being able to understand that their brains are still developing to the maximum potential that they can at that age. 18 to 25 is very crucial. That's why a lot of mental disorders you cannot diagnose before 18. But with that said, I think the goal was to get people young because you're fit. You got to be fit to fight. The whole mental, spiritual, that's not quite developed. And I don't think that was something considered when joining the military, because once you're in order to deploy and be called, ready for deployment, it's called personnel readiness. You have to be physically, mentally, spiritually fit. You can be spiritually fit, I guess, at 17, 18 years old. Mentally, no, not to me. I mean, there's some people that mature, you know, faster than others, but when you're thinking more about how young adults are exposed to military and combat at a young age, and then look at the repercussions after they come back from training and war, now they're just now understanding the damage that can be done. Because you got to think, even before I went to war, so before they call it OEF for Iraq and Afghanistan wars, but you got to think about Desert Shield, the Vietnam War, the Korean War. All those people drafted, they were still drafted at 18 years old, but we wasn't thinking about these things, brain development, cognitive performance. But they would come back and they would be diagnosed with, it was called shell shock, which I think shell shock is now what they call PTSD, and not understanding what's wrong with them. They're coming back, oh, it's the, exposure to war, but nobody's doing like neuropsychological, like comprehensive neuropsychological evaluations to determine what is the severity due to the effects. And then based on the results, should we keep them in the military? Or we keep them in and then we'll give them like office duties, but then we can't send them back to war. But that's the thing, they're cycled to go back to war. You come back, you do your reprieve, rest and recuperation, you get right back into your cycle of training and you go back out. So with that said, I don't think the military really thought about it. I think they're thinking about it now, because now being in the 21st century, I think the way training for military is now is totally different than even 20 some years ago when I did it. And then before the people before me who did it in the 20th century. And I think they're being very mindful now because they're seeing mental health issues more now than ever in the military. And I think that's good on them for doing that. They have multiple neuropsychological brain centers now based on initiatives to help active duty members to determine if they can stay on active duty, if they can be able to tag them if they're no longer deployable, and if they need to be medically out they can transition them out, but at least they know what's going on so they can have that proper treatment once they transition, to be a veteran and then have to be able to function in that different type of life.
Yeah, I mean, and I think we need a lot more of that. I mean, you can have a car accident or whatever and break a leg or a hip or have surgery and have those things. They always send you to rehab so that you can go home and function physically, right?
Mm-hmm.
You know, so why wouldn't we do more of this in the military? Why wouldn't we do more of these evaluations and make sure that there's some kind of, like, let's just say I go in and it's a scale from 1 to 10, and I come out and I have all the tests and say I'm a 4. 4 is okay for functioning, 4 to 6. But if you were, 7, 8, or 9, or a 10, maybe you need additional therapy, so to speak, so that 1 year, 5 year, 10 years down the road, it hasn't plummeted and now you're in real trouble and it's hard to repattern.
Right. I totally agree with that. That's something that I had mentioned when I was speaking with my friend on another show. There's not a good transition for mental health. There's programs for the military. It's called TAPS, Transition Assistance Programs, for them to transition from basically learning how you lived your life in the military for all these years. Now you're cross training into the public sector. You have to get a civilian job. It's a good program. I went through it. There was not a focus on mental health. The only mental health evaluation I had is when I had to file my claim with the VA. And I remember it being like a screener. I don't remember it being an in-depth evaluation where they could determine, oh, wow, you've been on active duty. You have this. Were you aware of this? Have you ever been in therapy while on active duty? I mentioned that they should have every person who's transitioning to have a comprehensive evaluation prior to getting out. That way, before they get out, if there's any issues, they can have the proper treatment set up by the time they're in the VA system, and we can try to have a smoother transition, but that's not happening. That's not the focus. Once a person gets out, they do file a claim. They go through the mental health process, especially if they were diagnosed with something while on active duty. But then we go back to the need for having more military psychologists. We don't have enough. And I can attest to that because when I was doing evaluations, they were sending them off base. They were sending them because they just don't have, the manpower. And then they don't have military neuropsychologists enough of them to be able to focus on the brain, right? Be able to determine these issues. They do screeners, and if there's screeners, like you gave the number, based on the number or the results from that screeners, they're moved to a different location. What there is, okay, you're going to have treatment, or we need to do a, further evaluation. But I haven't seen like a really substantive program where it says, we're going to screen everybody who comes back from war. We're going to screen everybody who comes back from training, something like that, and then be able to put them, where they need to be based on their conditions. If they're fine and, cognitively, excuse me, they can perform, there's no reason to have them separate from the military service. But then you have to go back to everybody has to be ready. That's the whole point of being in the military. You have to be mission ready. If you're not mission ready, you should not be serving. So it's almost like a catch-22 situation. We need to help those on active duty that have mental health, problems. But if they're so severe that they cannot serve, then they're forced to, separate and transition out.
Yeah, and as you're talking, I'm thinking like, well, if they had these tests throughout their enlistment, right? And
Mhm.
you know, if you and I'm a forward thinker, so I'm thinking if you have this database, and let's just say somebody like me has different, test scores of, different periodic years that I'm in there. Oh, I'm a 4, I'm a 3, I'm a 2, I'm a 7. Oh, Sandy's a candidate for becoming a 10. So we need to back her up a little bit and either decide, does she go forward, or do we do some therapies to help her never get to a 10, never get to the breaking point.
Mhm.
So I feel like, and so what I'm hearing now from Spirit is, I am convinced that you went into all of this to open the eyes and light the way for a whole different thought process of how to help those and bring in programs so that we can have better outcomes and people can live a happier life or a more sustainable life without having to be so severed from who they authentically could be if these traumatic events didn't occur.
That is the entire goal. That's the entire goal. Speaking to some veterans that I've worked with, the ones especially that I told you say they feel broken, they always felt like if somebody intervened or there's some type of intervention that prevented them from getting this far, maybe things would be different. And that just shows that the system is broken. And I'm not here to talk negatively about the
No.
military. I love the military. The military is responsible for my entire being. And I will say that. I wouldn't be in a position to sit here right now and have this conversation if it was not for, you know, the military and Department of Defense. But what I can say is there's not systems in place that prevents them from worsening. There's people who, like I said, if they're found that they cannot be fit to fight, they're forced to separate, and then they're forced to figure it out on their own. And then even with the VA system being bogged up too, that's another, limiting factor for them to get treatment, because now we got to deal with the bog system where they can't get help. And then they're forced to civilian services because of the need to have more VA physicians, VA mental health professionals. So a lot of the veterans come lost. They feel like, okay, now that I know what's wrong with me, how can I get the help that I need if the help is not there? And then they feel like they're just a number too. They feel like I'm a number, I'm a robot, nobody cares. They're just doing what they have to do to push me out the way, and I have to fend for myself. So that's why I feel like these programs should be in place, just like stages. There's screeners that they have to do. There's screeners before deployment, after deployment. I was part of that process. I do remember when I came back, they screened me for 3 years. Once every year, I had to be screened. And it was major, I think particularly looking more for major depression and PTSD because of where I was, the location of where I was and what I did. And I was fine through all those screeners, but everybody's not fine in those screeners. And then once you catch something, what happens next? Like I said, it's like black and white. It's either if you can't function, you're going to keep going. You're going to keep working with your mental health conditions. If it's severe, we're going to send you out. And that's the way I see it to be, because I don't see a difference. When I see veterans coming out, and they're saying, yeah, I was forced to get out because I have major depression or I have major anxiety, PTSD, and I didn't really get help because there was no psychologist in the military for treatment, or the treatment wasn't helping, or I got in trouble. That's another one too, mental health conditions. And now they're getting kicked out because even though they have a mental health condition, they did something bad that warrants them to be separated from the military. So then we're dealing with the effects of that. Because if you have a dishonorable discharge, you no longer are eligible for benefits to receive help. And that's another thing that's not thought about. If you can't get medical service, mental health services because you have a dishonorable discharge, how are you going to be able to even find a job? Because a job is going to ask for that DD 214 to see if you had an honorable discharge. Now you don't have any any resources, any assistance, and now you can't get a job because you have a dishonorable discharge for something you did on active duty, which kind of could have been, based on your mental health condition too. There's so many different, stories that I hear, and that's why forensic neuropsychopathology is important, because we really have to find the line between being criminally responsible. Is it their fault if they're not getting the treatment, especially if they know they need it and they're asking for it, or they're using their mental health as an excuse to commit an act? There's a fine line. And that's why I'm so passionate about the field, because I want to dig deeper into both, hold those accountable who commit acts, and then, get the treatment for those who commit an act, but it wasn't intentional, just based on the severity of their mental health condition. So.
Well, what's screaming in my head is preventative, 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 and I think we need to be more proactive on the preventative side of this. I know one of my jobs is elder care, and sometimes people have to get chemotherapy, and I might be their caretaker to take them to chemotherapy or radiation or treatment. They may not have it in their community at all, the type of treatment that they need. And so they have to travel, sometimes very far, and then go through 6, 8, 10, 12, 15, 20 weeks of therapy, of treatment, and some places will have places for them to stay that is, supported by some kind of foundation that pays for it. Others have to pay out of pocket, might not be able to go, and they may be having the physical part of, say, a tumor or cancer or whatever it may be working for them. But what I see is the mental decline that happens when I'm sitting in that room watching the people that I, not just the one I've taken, but the people that come in and out for those weeks and weeks that I may go in with this one client. I watch them change physiologically and mentally change, and there's no support for people like them either. And so I think we have a lot of these systems that aren't even being band-aided to assist, and that are people are lives are falling between the cracks. And so
Mhm.
for you to go into what you are, so could you please tell the viewers what your educational background is and the title to each one, because there's so many. I'm like, I'm just like, she's amazing. I can't even pronounce.
um, okay, I have to think about it for a second. So I have a bachelor's in Homeland Security, a master's in criminal justice, a master's in psychology, master's in clinical psychopharmacology, a PhD in public policy and administration, and a PsyD in clinical psychology with an emphasis on forensic neuropsychopathology.
Okay. So the one that's catching me right there is the what would you say, psychopharmacy? Which one was
The
that?
clinical psychopharmacology or
Yeah, the
mhm,
pharmacology one.
mhm.
So what exactly does that mean? Does that mean the study of medications, pharmaceutical medications on something, or your ability to dispense them, or your ability to study them while they're on it? What is that?
So that degree, actually, what you said is the ability to be able to understand. It's really relative to psychotropics, so medications of the mind. So you have your regular pharmacist, and then you have psychopharmacologists that just deal with psychotropics, anything that affects the mind. So I pursued that degree because after I get licensed, eventually, I'm going to go back to school to do my clinicals so I can be able to prescribe. So you need that degree to be able to prescribe and have prescriptive authority since I'm not a medical physician,
Mhm.
because only medical physicians at this time can prescribe medications. And then psychiatrists are the ones that usually prescribe psychotropics. But clinical psychologists, if you're licensed and you have prescriptive authority, you can prescribe medication. But I think there's only 5 or 6 states that allows it right now. Not every state allows clinical psychologists to provide medication.
Wow. Wow. Yeah, I know my girlfriend's a psychiatrist, and I think that all of her practice is always going around how the medications are working with the blood-brain barrier,
Mhm.
behavioral issues, working with the psychologists,
That too.
and then you've got the psych nurses who have the abilities to do a lot of things, but they don't quite have all the things that a psychiatrist have, but they both can
Right.
write prescriptions. A family nurse practitioner really doesn't work with mental health. They'll do more family practice, functional
Mhm.
medicine, those kinds of things, aesthetics, those kinds of things. So this is a specialty to go through that. I don't think you have enough schooling. I think definitely go back. When you were saying that, I'm like, yes, of course she needs to go back for
I'm a life
more.
learner. I'm never going to stop learning. And I feel
Ah,
like the more I go to school, the more I'm aware of not only what I'm doing, but understanding more about the human mind. That clinical psychopharmacology degree, if I never prescribe, never get licensed, I have enough information that when I'm dealing with patients, I can understand when something's going on based on the type of medication that they're taking. There's a few times where I've caught that people were misdiagnosed or even given the wrong type of psychotropic for their condition, and I was able to catch it. So, I mean, just having that knowledge to be able to understand what is called psychodynamics and psychopharmaceutical psychokinetics, to be able to understand how the body functions with medication and then how the medication functions with the body, it's very important. So if I'm dealing, for example, dealing with somebody I had one that they were diagnosed. I diagnosed them with adjustment disorder because their grandparent unexpectedly died and they were very close to that grandparent and it was hard for them to adjust. They were diagnosed by another practitioner with anxiety and was put on an anxiolytic, which was very powerful. That's for people who have severe anxiety. And the person was like literally crying every day for no reason, didn't have a reason to be crying, didn't understand why they were crying, couldn't sleep at night. And I'm like, what's going on? This is going on for like 3 weeks. And then I'm like, that medication. What medication are you on? How much?
Mm-hmm.
That's a lot. For what? Oh, no. You have anxiety, but it's really adjustment disorder based on the time frame, your symptoms. You don't need the medication. So I talked to their provider and we discussed it. The provider said, "Oh, I'm going to, wean them off, titrate them off the medication." And once they did that, person was fine. So I believe in going to school, not just for the degree, but actually taking in the information and learning about it, because that could have went a wrong way if they continue to be on that medication, because one, it's addictive. It's a powerful drug. And two, it's not helping the symptoms because the symptoms that were occurring were different than the diagnosis. So in those instances, I'm like really happy that I go to school. I'm going to continue to go to school. I'm going to continue to learn. You will not be surprised if you hear that I'm in school by the end of the year again, learning something.
Well, I was also thinking about, the pharmaceuticals, such as these medications, um, can permanently change the brain. We haven't done enough
That too.
studies on these
That
things that
too.
alter someone where they can't be unaltered or go back to some kind of neutral baseline. And that I think is extremely sad, but it's also something that we must, it's a window that we must go through and open the doors for more mental health in all
Yes.
areas, not just the military, but everyday life. And as you're talking, I'm thinking of all the different jobs that I do and the people that I go through and in my own life. And I'm
Mm-hmm.
thinking, gosh, this pertains to all of it. Um,
Mm-hmm.
because some of these medications can alter you so much that it can make you suicidal or very
Yeah.
clumsy
Some of
or
them. Mm-hmm.
just no appetite. Your personality is deadened. But the alternatives might be something that outweighs why you need to take it. So
Exactly.
I think we need a lot more studies. So, girlfriend, I am, like I said, I'm just in all of you. I want to thank you for sharing all this information. We're going to do round two coming up. And is there anything else that you'd like to share about yourself to the audience before we sign off?
Sure. So if you would like to follow me, I'm on, I think, every social media platform except for Snapchat and TikTok. So I'm on Facebook, Instagram, LinkedIn. And then my professional website is www.thechouráeshkenazigroup.com. I don't know if you want me to spell that.
No, because we can see it there in your name, and then I'll put the link in the show descriptions on
Get it.
YouTube and on the podcast platforms. So, Dr. Monique, I we are just going to have to keep exploring this and get this word out here so people can begin to awaken to another avenue that we are just not investing and investigating enough of ourselves to understand it, because mental illness is within each and every one of us through
Right.
traumatic events and situations. Um, damn, adjustment disorder, that it
Yeah.
runs rampant because some people just can't switch gears easier than
Right.
another, and we don't realize the effects. And if we could start understanding a lot of this more, we may be able to start implementing this at a young age so that we can work with children who maybe have a predisposition for certain things or inabilities to maybe exit stage left or pivot a little bit better, not just the ones that are in a traumatic event or after the fact. So I just want to thank you so very much for taking the time to come on today. Everybody, just please like, subscribe, share, pass this video around. We need to get this word out, and we're going to have Dr. Monique on again very soon. So Yeah, you can say goodbye now, Dr. Monique.
Thank you so much for having me. It's certainly been a pleasure. Thank you.
Oh, you're welcome. And thanks for tuning in to Keeping It Spiritually Simple. We'll see you on the next show.